in the county. We've actually increased revenue through our integration efforts by over $2 million. The $1.2 million that you see there with shifting mental health staff to social services, we were able to do that, and we were able to save approximately 20 positions in mental health, and we did that over the past year. The annual federal revenue generated, the $888,000, that's an annual figure. Every year we could bring in an additional $888,000 into this county because of our leverage dollars with the integrated services. So what we've done on top of leveraging funds to reduce our costs, anticipating a shortfall from our state funding, is we reduced our in-county travel, we reduced our out-of-county travel, and we reduced education and training. So the first 6 months of the year, we've saved $156,000. We could double that, not quite, because training isn't as high the next 6 months, but we still will have a savings in travel and some training over the next 5 months. We restricted building improvements purchases. Let's hope we don't have a really heavy rain in the Okeo building, because we stopped a $90,000 roofing project on the Okeo building. So the $427,000 is really an annual figure, and that's a savings for this year for 0809. Extra help and overtime. We've eliminated almost all of our extra help except for 24-hour response positions. We have a mental health crisis unit that's open 24/7. We have not been able to eliminate extra help in the crisis unit. We also have staff that respond in adult protective services and child welfare services. We have not been able to eliminate extra help with the 24-hour response. So we're doing our best to bring those numbers down and to save costs. And then our overtime is actually below the budgeted amount right now. So we've saved a total of $61,000 there. So the first 6 months of this year, we've saved $644,000 in the agency, and one would think that that's enough. Unfortunately, it's not. We have to commend our staff for voluntary time off. We started talking and planning for VTO and asking the staff if they'd be willing to participate in voluntary time off. We started doing that in November, knowing that we were facing a shortfall. And November and December, our savings has been about $39,000. So we really have to commend the staff for participating in the solution and helping with VTO and saving dollars for the county. If we do nothing more going forward, it'll cost the agency a little over $12,000 a day. And that's, if you recall, the $1.6 million, our money here, that's a shortfall from the state revenue, and then the federal match. If we do nothing by the fourth quarter of this year, it'll cost us $26,000 a day. What you see here are staff suggestions. I don't want you to think that we've just focused on the dollar and we haven't focused on anything else. Yes, we're very much focused on the dollar, because we know if we don't have the money to run our programs, we can't have staff to serve our clients. So it's really important to us that we balance our budget and we have the money for our services. However, we also know that it's important to our staff and our clients as well. So over the course of the last month or so, we've asked our staff, give us some suggestions. And some of the suggestions that came forward are what you see there. We've compared them with the SEIU response as well. Most of our employees are in SEIU, and they called for staff suggestions as well. And so you could compare them, and you could see that the three top suggestions by the staff to their union representatives and also to the agency administration was a shortened work week, office closures, mandatory time off, reduced travel costs. I believe that the staff are willing to share the pain as best they can, not to see layoffs with their coworkers. So what we're looking at going forward and what we think needs to be done for the agency, some of our options. We plan to continue reducing our extra help, eliminating extra help as we can, reducing our overtime, and eliminating travel and training to the best that we can. For 0809, the total will be a little under $300,000. You know, when we talk about our plans, we're not talking about now until July 1. We're really looking at a 2-year strategy. We'd look at a 3-year strategy if we could, but we really can't think past 18 months right now. Every day is a new day right now, not only in the nation, but in the state and in this county. So as we plan, we know that some of our numbers are moving targets. We're hoping to plan for 0809 and 0910. And you can see for 09-10, if we continue with eliminating the extra help, reducing the overtime, we could save over $500,000. We're also looking at laying off agency staff. Now, the number we have up there is 20 agency staff. And what we're looking at is a focused approach. Those programs that have a revenue shortfall in their dollars are the programs that we're looking at. So the 20 agency staff that we're looking at for layoffs, those positions, those classifications, are in social services right now. You know, it's interesting that social services has always been the most stable arm of the agency and probably one of the most stable departments. Certainly the largest department in this county has always had a great budget. We've been able to grow social services in this county, and this is an unprecedented time where we can't go to social services and say, help us with public health, help us with mental health, help us with the county deficit. It's unprecedented. And so when we talk about layoffs, I'm here before you today talking about social services staff. Mandatory time off. You know, I know that the county is looking at mandatory time off as well for the general fund deficit. What we're looking at, and this is based on suggestions from our staff, a 36-hour work week, which would be a 4 9-hour day schedule. We would keep county offices, agency offices open Monday through Thursday with a 9-hour day. We would be closed Friday, Saturday, and Sunday. Now, there's a few advantages to this. I mean, there's obviously lots of ways of doing mandatory time off. We could just say 12 MTO days, and staff could pick those days as they choose. If we do a set schedule of 4 9-hour days, then the community knows this is when the office is open, this is when services are provided. We could have on-call staff for those services that need on-call staff. And staff know that they're off every Friday, Saturday, and Sunday. We have a lot of staff right now in the agency that are single parents that need child care to come to work. They can count that on Fridays they don't have child care, they don't have a child care expense, they don't have a commute expense. And unfortunately, we have a lot of staff that have second and third jobs, and they could look for additional work on that Friday. Now, you know, it's just the nature of what we're doing, that if we go down to a 36-hour work week and everybody's paycheck is affected, there will be some staff in the agency that will be looking for additional work or looking for work elsewhere. So we can make it as easy as we can, or as palatable, it's not easy, but as palatable if we look at a set schedule and we look at consistency across the board. Additionally, we continue to review all our contracts, and the purpose there is to be sure that the services that we're paying for are, one, mandated services and necessary services for the county. And if there's any areas in the contracts then we could reduce or eliminate, we'll do that. And then also we're looking at our supervisor to staff ratios, and we'd like to modify those as we can and when we can to meet a 1-to-10, 1 supervisor to 10 staff. So there are still areas that we're looking at. We've been vigilant, and particularly with the integration. We've looked at a lot of our programs and how we've delivered services. We continue to do that. As we continue, we're looking at over $1 million savings for 08-09 here, and the impact for 09-10 would be a little over $2 million with these measures here. Now, one caveat is that all of the planning we've done up until last night, all of the planning we've done has been based on approximately a $2 million deficit of health realignment VLF for the agency. These figures are based on a county general fund contribution maintained at the current level. As we've learned, the county general fund deficit is approximately $2 million. The general fund contribution to the agency is a little over $5.2 million. If that's cut by 10%, that $500,000, it could result in an additional reduction of $1 million of state and federal funds. If county general funds are cut out of the agency, we may be talking a potential loss of an additional 13 positions, 13 staff, 13 people, additional reductions in services.